Hi everybody, welcome to another episode of Body by Ravi Plastic Surgery. Today I wanted to talk about breast augmentation. It's the most commonly performed procedure in my practice, and I wanted to talk a little bit about what you can expect when you come to the office for a consultation. There's different types of implants out there. There's silicone and saline implants, and unlike 10 or 15 years ago, we have more implants that we can offer to patients than we did 10 or 15 years ago, which means that the results with breast augmentation are that much better. Because not every single person coming to the office is the same as the next person coming into the office, we have to individualize our implant option from patient to patient. And that's extremely important in order to get the best possible result for every single patient. And that's the key, it's individuality. Implants come in all sorts and shapes and sizes and whatnot. There's saline implants, there's silicone implants, there's textured implants, there's smooth implants, there's anatomic implants, there's round implants. There are highly cohesive gel implants that have high fill volume ratios, and there's a lot of science that goes into making these implants. But you don't have to worry about that. All those things kind of are taken into account when you come into the office, and I sit down and talk to you because I'm basically talking to you about what your goals are. And then we're going to take measurements. And those measurements are specific for you, and they're not specific for anybody else. And so along with the discussion that we have in the office, in addition to those measurements, is going to dictate the size of the implant. Then you're going to try those implants out in the office with sizers. And you're going to actually look in the mirror and visualize for yourself what you're going to look like with breast implants in place. Now, a lot of people, when they come in for breast augmentation, they say, well, I don't want to be too big. And that's fine. You don't have to be too big. You don't have to be too small. The issue here is that there's so many different implants, literally hundreds of different implants of all shapes and sizes that are going to be able to give you the result that you're looking for. Now, saline versus silicone, what are the differences? Well, in a silicone implant, both saline and silicone implants both have silicone as their outer shell. So people don't realize that, but the inside of a saline implant is made of salt water. The inside of a silicone implant is made of cohesive silicone gel. Now, there are downsides to and benefits to each one. Let me start with saline implants. Saline implants have a higher chance of rupture or popping, so to speak. Between 1996 and 2006, saline implants were the only implant available in the United States by the Food and Drug Administration because they placed a moratorium on these implants. You couldn't get them because there was a concern about silicone implants. As we all know now, silicone is back, it's better than ever, and it's very, very safe. But silicone implants, even today, in today's world, silicone implants or saline implants have a higher chance in 10 years that the shell is going to break. If it does and the saline implant pops, it's salt water, it's not harmful, it just means that one breast is going to be smaller than the other. And it's an easy fix. You come back to your plastic surgeon and they take out your saline implants and we can replace the implants. But saline implants have a higher chance of popping or rupturing. Silicone implants, on the other hand, have a much lower chance of rupturing or popping. However, they're still made by human beings and they're made by machines, and so there's still a possibility, although extremely rare. And I would say, over a course of a lifetime, you're looking at probably a 2% to 3% chance that these implants are going to rupture, which is actually very, very low, and that's good. But if they do rupture, sometimes it can be a little bit hard to tell. If there's obviously any question, you come back to your plastic surgeon, and sometimes we have to get an MRI to determine if the implant's ruptured. And there are warranties on these implants that if the implant is ruptured, that you can be covered to get the implants removed. But basically, saline implants, again, higher chance of rupture than a silicone implant. Silicone implants definitely feel much more softer and natural than a saline implant. So there's no right or wrong answer. There's nothing that says that silicone implants are definitely better than saline implants. I prefer silicone implants. Most of my patients get silicone implants. 99.9% of all the patients in my practice get silicone implants. They like the way they feel. It's softer. They like the fact that, again, they don't rupture as often as saline implants. And so, for those reasons, in my practice, silicone has definitely been the implant of choice, although I still put saline implants now and then. So those are the two big differences. And then we talk about, is the implant going to be above the muscle or below the muscle? Well, in the ideal world, I like to place the implants actually above the muscle. And actually, and the reason why is normally the breast tissue sits above the muscle. And so to get the best you get the best result, it's best to place the implant above the muscle. Now, in all cases, in many cases, that's not the case. Women who don't have a lot of body fat, who are very, very thin, you need the extra cover of the muscle. And women who've had children who don't have a lot of breast tissue also need the extra coverage of the muscle. And so in those cases, it's very important to place the implant below the muscle. In some women who don't have children who have a lot of breast tissue or enough breast tissue, my option would be to place the implant above the muscle. Ultimately, sometimes some women come in and say, listen, I don't care, I want the implant below the muscle. And there's nothing wrong with that. You can place the implant below the muscle. But the difference between above the muscle and below the muscle is subtle. And everyone's different. There's no cookie cutter approach to this. And it's individualized. So if you do have a history of breast cancer, that's extremely important for me to know, because if you do have a history of breast cancer, the implant should definitely be placed below the muscle. That's because when it's time to get your mammogram, you can visualize the breast tissue better, and there's a lower chance of you missing anything. So in all my patients, I always ask them about their breast health, self-breast examination, history of breast cancer, whether it's personal, obviously, or it runs in the family, and a first-degree relative. And if that's the case, we basically place the implants below the muscle. And then it comes down to where the incision is going to be. In 99.9% of all my patients, the incision is placed right in the fold underneath the breast. This has never been a problem. No one ever has come back to me and said, oh, I don't like the way my scar looks, or I can see it. If you're looking for it, you're going to find it. But if you're wearing a bathing suit, or if you're wearing clothes, it's right in the crease, and it never bothers you. And the reason why the crease incision is better than the incision around the areola or in the armpit is there have been some studies that suggest that if you place the implant in the crease, there's a lower chance of developing scar contracture or capsular contracture. It's cleaner because you're not around the nipple, and the nipple can be dirty during surgery. And so that's the reason to place the implant, in my opinion, in that IMF crease. Now, in the very low chance and probability that later on you need to go back in through the same incision, you already are going through the same incision, and you don't need to create any other scars or any other incisions. And so therefore, in my opinion, the IMF, or the crease incision, is the most commonly used incision and has its benefits. So I hope that's been helpful, and this is an introduction to breast augmentation, but really the take-home point also is that if you're considering breast augmentation surgery, make sure that you are seen by a surgeon who is board certified by the American Board of Plastic Surgery, is a member of the American Society of Plastic Surgeons. Those qualifications ensure that he's well-trained, he or she is well-trained, and that they have a lot of experience doing breast surgery. And also make sure that you look at their before and after galleries, because although the before and after galleries are not supposed to serve as a buffet to say, oh, I want to look like that or I want to look like that, the best way to look at a before and after gallery is to look at somebody who's very similar to yourself, and then read the caption that says, this patient has a 375cc implant. So if your starting point is similar to somebody in the before gallery, you can get a sense to say, this is what I might look like with a 375cc implant in. That's the way to look at it. But anyway, look at the before and after galleries of that surgeon, because it gives you an inside look into what their aesthetic is, as well as what you may generally look like with breast augmentation surgery. So hopefully that's been very, very helpful. As always, if you have any questions, please feel free to call our office or visit our website. And until then, I will look forward to our next video. Take care.